Now that we've learned some methods for preventing opioid overdose, let's discuss what you can do if you discover someone who may have overdosed. At the beginning of the video, we showed you someone treated for an overdose, but now let's break it down to reveal the thought processes and steps taken to treat this emergency. When you get to any emergency scene, it's essential to secure the scene. This means checking that there are no other hazards to you, to bystanders, or to the person who needs help. Assessing hazards includes ensuring bystander safety, including unnecessary exposure to viruses when doing CPR. You should wear a mask following current CDC guidelines during the COVID pandemic. Use an N95 or KN95 mask if you can, since you're treating a medical emergency, and wear gloves. You'll have to tailor this to the scene and the situation since you might be treating someone who is living with you. The first thing to establish is whether the unresponsive person can be awakened by yelling. "Wake up! Wake up! Hey, wake up!" If not, then use a sternal rub. You do this by rubbing hard on the breastbone in the center of the chest with your knuckles. If no response or the person needing help goes right back to sleep, get help by calling 911. "Somebody please get help, my friend's unresponsive." If you are alone, do this yourself. "My friend's unresponsive, I'm giving Narcan. We're at 123 Memory Lane." Next, open the airway. Now, listen for breathing. If the person isn't breathing or is only gasping, begin CPR with compressions. If you have an AED, they can help keep a person alive if the heart has stopped or is beating erratically. If normal breathing is present, stay with the patient and continue to monitor them until help arrives. Now, give Narcan. Remove one of the nasal spray devices from the box and open the blister pack. Hold the nozzle between the first and second fingers with your thumb on the plunger and put the nozzle in the person's nose. Make sure your fingers are at the bottom of the nostril and the tip is inserted well into the nostril. Using your thumb, press the plunger completely in. When done, dispose of the device. The goal of reversing overdose is returning the person to breathing on their own, not that they are fully alert. Giving too much Narcan can place a person in full withdrawal, which is highly uncomfortable for them. But if they haven't started breathing well on their own in 2 to 3 minutes, give another dose of Narcan, this time in the other nostril. Be aware that Narcan is only effective in the body for 30 to 90 minutes. Depending on how much, how potent, or how long acting the opioid is, determines if or when the person who has overdosed might stop breathing again. The takeaway is to give enough Narcan to allow the person to breathe on their own, but to stay with them until EMS arrives because long-lasting opioids can regain control of the opioid receptors and cause breathing to stop. Maintaining breathing is the most important reason for a person who has overdosed to get treatment from EMS and get to a hospital. One more thing, when the person who overdosed begins to breathe on their own, place them on their side, with their head tilted back to help them keep their airway clear. This is especially important if you must leave the person. So that's the whole process of rescuing someone from an opioid overdose. You've seen it twice now, and you can repeat this segment until you feel comfortable that you can help. So we've seen what to do if the person who overdosed responds slightly when you try to arouse them, and so doesn't need CPR. But what do you do if there isn't any response at all? Just grunting breaths or no breaths and no response to a sternal rub? The answer is uninterrupted CPR using chest compressions at the rate of 100 compressions per minute. If you're alone and the patient is unresponsive, it is critical to keep CPR going and supplying oxygen to the brain rather than spending time giving Narcan. Some limited studies have shown that chest compressions do not produce a large volume of virus exposure, but to be safe, you should wear a mask if the person you're helping doesn't live with you. And you should put a mask on the patient as well. Remember, you give at least 100 compressions per minute, equivalent to beats in the song Staying Alive, and press down at least 2 inches for each compression, according to the new 2020 American Heart Association guidelines. If you aren't yet certified in CPR, please get training. If you know you are around someone who uses opioids, this too can be life-saving. One other aspect we should cover is what to do in a public place with many bystanders around. In this situation, if the unresponsive person can still push your hand away but isn't breathing normally, give Narcan and repeat in 2 to 3 minutes. But if the unresponsive person isn't breathing and has no response to a sternal rub, have someone call 911, have someone get the AED, and have someone else give Narcan while you start compression-only CPR.